And it's always a very helpful discussion, even though I have no idea what the first slide is.
So good morning, everyone. Can anyone unpack any of those acronyms? Are they familiar to anyone? Sorry?
Yeah.
Yeah? So which ones?
TLE.
TLE, what's that?
Temporal lobe epilepsy.
Correct. Any others?
What is it?
Temporal lobe epilepsy.
Oh, okay.
Any of the others familiar?
Swimming.
So basically what we're talking about, what I'm going to be talking about is TLE, so epilepsy, LGG, low-grade glioma, so brain cancer of a low grade. DA is diffuse astrocytoma, and we'll unpack these words. IDH1 positive is a mutation that was found within the LGG. So I'll be talking about the symptoms, about the diagnosis, and about the linguistic and cultural considerations we need to think about in this whole space of understanding symptoms and giving, prognosis and diagnosis. So, TLE, temporal lobe epilepsy. So when I went to the specialist and I said what my symptoms had been, he was like, textbook TLE. I was like, okay, so obviously everyone needs to know what these textbook symptoms are and become more familiar in all of our worlds so that we know what they are. We'll unpack these symptoms and think about the language and culture differences in the expression of these symptoms. So the first symptom I felt was what I could only describe as déjà vu. Very, very strange. So when we look at what déjà vu means in the dictionary, an illusory feeling of having already experienced a present situation. When we do this in Australian Sign Language, it's like this. A picture coming forward randomly, a picture from the back coming forward randomly. That's one way to express it in Australian Sign, so quite literally. In Aranda, if makama akota akota is one way that maybe an Aranda person might express this through their interpreter, and the interpreter might come back to you as the English speaker and say, it's like remembering something over and over again. But then, is this a TLE symptom or is this a trauma symptom of having a flashback? So there's ambiguity in that kind of space. Medical English, the term is called aura, obviously, and this is called I don't even know that word. How do you say that? A premonitory symptom of epilepsy. So it's what people describe as the warning that you get when you feel an epileptic seizure coming on. In Aranda, in Walbury, when I started to talk to my colleagues about this whole thing, they were like, whoa, that's moving into that other realm. That's moving into that spirit realm. And these are these important spaces that are very blurry within particularly mental health. It's important to understand these spaces between the spirit world and the physical world and people's cultural world. So they're saying, that's like that Miralpa space, and in Aranda, that's the Aranda space, that's the spirit guardian space, that's moving into another realm, talking about these kinds of feelings. So just good things to be aware of. This one was nice and easy. Nausea. You can express nausea. That was the other symptom. So déjà vu was my first symptom, and then nausea. And this can easily be expressed in all of these languages unambiguously. Australian English means I'm sick in the guts. Australian Sign, it is just that. And Aranda, Anuka, Anoa. So I feel like I'm going to vomit. So that one is an easy one where there's not much ambiguity. The other important symptom that I was having was that I was fainting, and my sister, who's a sister down in Adelaide, she's like, you shouldn't have said fainting. You should have said you were losing consciousness. That's why those doctors didn't take you seriously. I was like, okay. Obviously my Australian English wasn't quite up there for the task. So she's saying there's a difference between fainting and losing consciousness. And I guess it's all about degrees of how long you're asleep for. So in Australian English, might be to pass out, a sudden loss of consciousness. In Australian Sign, it's just this. So, and you could be very expressive with this, like, I fell asleep and I woke up like that. So I was asleep, woke up like that, or I was asleep and I woke up like that. So this is giving you, as the medical professional, the indication of how long was this person actually out for each time they were having one of these episodes. In Aranda and Walbury, it's very complicated because the same words mean to faint, to be unconscious, or to be nearly dead. So obviously in the old days there was no coming back from a point of being unconscious. That was a point of being almost dead. And so these are how these words are expressed. So again, if you're working interculturally around these whole questions of how long were you asleep for before you woke up, then that's the critical question, is how long were you unconscious? So when I demanded an MRI at this point, after 4 months of telling my doctor I've been passing out and I was at the peak of my fitness, I just ran 10Ks. None of these episodes were happening while I was exerting myself. I was chopping vegetables or sending emails, not really doing anything in an exerting way. The last one occurred when I was driving my car with my son. Oh, hang on, sweetie, I can feel that thing coming on. Pulled up the car, thank goodness we could. No one was hurt. Hung up my keys, that's it. Got to get to the bottom of this. So, after my MRI here, this is what the path report said. A large mass, 7 by 5 by 4. So this big, this is a replica of the thing that was sitting right here on my temporal lobe. Mild medial displacement, obviously, you know, started to shove things over to the left because it's pretty big. Yeah, minimal shift of the midline structures to the left. At this stage, because of the contrast and the level of contrasting when looking at the image, the the person who read the report said intermediate to high-grade glial tumour. So because of the amount of highlighting, that was what gave the indication that this was intermediate to high, so maybe 3 to 4 grade cancer. And also, just to chuck it in, a little supraclinoid meningioma that's still in there somewhere, but they are benign, but they only become a problem if they get to the point where they're, you know, this one in particular will be obstructing my vision. So how would you have given me this news? The hardest part of your job, obviously, is giving people bad news. Could anyone want to volunteer? How would you have given me this news?
Ideally face to face.
Yeah. Great. Yeah. And how would you have said those? Told me these things?
I probably would have given you a bit of a warning.
Yeah.
I've got some bad news to tell you.
Yeah.
So you would have been prepared.
Yeah. Thanks.
I might have asked someone to bring someone to the appointment if that
Mhm.
seemed appropriate.
Yeah. Have someone else?
That's always a tough
That's always a tough
one.
It's always a bit of giveaway.
I've got some news. Would you like
Bring
to
someone.
a friend?
Given that, depending on the situation.
Yeah. And by this stage, I knew it was bad news, but I was expecting epilepsy, because I diagnosed myself via Google that, oh, I've got temporal lobe epilepsy. At least I know I'm not going mad, because that's the other thing. I could have easily ended up in a mental health spiral, particularly because, you know, deja vu. Oh yeah, that's weird. She's obviously mad. Let's put her in Ward 1. You know, really easy to misinterpret some of these very strange symptoms. So when we're thinking about bad news, and thank you, that's a nice gentle way to give a privileged white woman bad news. If in different languages there's different ways of giving bad news, obviously, because language and culture are all stuck together. So had my doctor been a German first language speaker or a Dutch first language speaker, we have one. And can you please, you know, give me some feedback on this? It might be way out there. You have a huge brain cancer. I'm sure you wouldn't do it like
No,
that.
I don't think it's done like that, to be honest, in a German hospital.
Okay.
You
What
would-
about in Germany, in German? If you were in Germany and a German doctor was giving you this bad news, would they give it to you that directly?
I don't think
It
so.
still wouldn't be
No,
that
no,
directly.
No. We also are, you know,
Human beings.
Talking
Yeah,
around
yeah.
it, talking around
So I
it.
don't know. Maybe this is just
Stereotype.
a stereotype. Exactly.
Yeah, it is stereotype, and it's just an example to show. I went to an interpreting conference, and the Germanic language speakers are like, "We just give it to you straight. We don't fluff around," and all the Latin-based languages are like, "Oh, no, you can't say it like that." So it's just a fascinating sociolinguistic space.
It depends a little bit on what the news
Yeah,
are. You know, if they are not
sure.
terrible, in German it would be even very straight.
Very true.
Something like that. You
Yeah.
know, I've never experienced anything.
Okay.
You haven't
Thank
got
you.
the British there.
No, I don't have British. How do you think would be appropriate in British English to give that news?
Round and round.
Around and round, because in English we have 300,000 adjectives. You know, we have these describing words to be poetic and to talk around stuff. In Bidinjara, you know, hardly any. get to the point. So in Italian, my friend, Maya Tivoli, she interprets these kinds of situations all the time, and she was saying, look, in Italian we must soften the pill with sugar and ribbons. So we would say maybe something like, I would tell the doctor, maybe you can give the news in this way. I can see that there's a large tumour which is causing trouble. We could remove it, and God willing, this will bring you back to good health. A long and difficult operation that I'm prepared to perform to give you the best chance of recovery. So a completely different way of delivering this news within those different cultures. So talking to my colleagues at the Aboriginal language, at the Aboriginal Interpreter Service, the few that I've spoken to so far, and I have many, many more to speak to about this because I find it so fascinating, one of the points made yesterday to me was that make sure the doctors don't say you have a sickness in your head. A sickness in your head is a mental health problem. A sore in your head is more like a tumour. So describing that you have a big sore in your head, you need to see a special doctor to find out what he can do about that. So giving that news perhaps in that kind of a way. Anyway, so I got myself down to Adelaide. I decided to go as a private patient because my sister worked at the Royal Adelaide and she said, we're moving and it's a mess. If you can go private, please go private. So I did that. Lucky I had that backup in my life. And when I told him those symptoms, you know, the deja vu, the nausea and the fainting, he's like, textbook TLE. That's what I decided to call this thing inside my head.
So you hadn't seen the scans before then?
No.
Before you went to Adelaide?
No, I hadn't seen them before I went to Adelaide. Just seen the pathology report, but no, hadn't seen the actual pictures. So here they went, whoa, okay, there it is. Dr. Santorinius did some tests on my balance in the consultation. He checked my fields of view, and then he said to me, look, I'm confident I can get that out of there. He used the word radical. I'm like, it's all right, I like radical if you think you can do it. He's like, yeah, it's radical and it's a lobectomy. I'm like, you mean you're like taking out a whole piece of my brain? He's like, well, yeah, pretty much, because, you know, it's big. I'm like, well, what are going to be some of the common risks associated with this operation? He said, there's a very good chance you will lose some vision. This vision here, which I have, so this high peripheral vision. And he said, you're obviously a high-functioning human being. You might just lose a bit of your high function. So you'll still be able to go back to work. Maybe one day you'll be able to drive again. But you just might not be able to do 10 things at once, maybe just 5. And I am finding that, yeah, God damn it, sometimes I can't do 10 things at once.
You didn't actually tell us how the news was delivered, which I think is important.
You think that's important? Yeah.
You know, if you feel you.
Okay.
Because I think that's...
So, well, after I walked back from the hospital to work, I got a call within half an hour from the clinic saying, we've made you an appointment for 1 o'clock tomorrow. I'm like, okay, they're ready. So I went in 1 o'clock tomorrow, expecting temporal lobe epilepsy. And the doctor said to me, how many children do you have? I'm like, right, this is bad news, but that's a really strange way of giving it to me. So, as a parent, you know, of course your first mind goes to your child. You know, you want to be around to raise your child. I have a 9-year-old boy. I want to be here till he's a man. And so I thought that was a strange way to deliver the news. I felt the world kind of open up at that point in time, and I felt myself falling into this abyss. But then it didn't take me long to think, all right, what have I got to do? So pretty much within a couple of minutes, I'd kicked back into having a joke with the doctor, what happens next? And as soon as I walked out the door, I just kicked into project management mode because that's what I do. So I had a page in my book for me, everything I have to do for myself, everything I have to do for my partner, everything I have to do for my son to prepare for this operation. So administratively and legally, I planned for the worst of dying, and emotionally and spiritually and yeah, I planned for the best to keep going. That's just how I managed the situation. So the day of the operation, I had these little dots attached to my forehead, and I went into the MRI, and this is like the stealth imaging, so they were able to get a really good 3-dimensional. Before I went into surgery, I wrote a message to the world just in case this was it. So I got on Facebook and I'm like, right, what's my message to the world? This is my last message. And it was, all we need is love and Mother Earth. So that was my message to the world. I was incubated, so because you've got to pass the blood-brain barrier, the anaesthetic is quite a different kind of anaesthetic. My anaesthetist was awesome, and I'll talk about him shortly. Once I was asleep, the burr went into one end, so my scar is shaped like a question mark. So the burr went in at the top, the burr went in at the bottom, so that's like that to drill the hole. 2 holes were drilled, and then a little foot and a router is put underneath, and that is kind of sawn like this. So the surgeon saws upwards, the powder from the brain kind of, from the skull dust sits on the top, and in actual fact, apparently it acts like a bit of a coagulant, that brain dust. So I was happy that I wasn't going to end up with brain dust inside my brain. That would be a bit not good. Anyway, yeah, I was asleep. I had no idea. In the surgery, there was neuronavigation going on, so Dr. Santorinius was navigating by vision, by his hands and his vision, but also by the computer-guided technology, so that he could... The operation was 5.5 hours. He had a 6-hour operation before me. I was 5.5 hours. He is an amazing human being. When I woke up, they woke me up half an hour after the operation. I opened my eyes, I saw my partner. It's like, oh, I know you, I know me, I'm here, I'm all good. My biggest fear was obviously leaving my child without a mother, but I would have had no knowledge of that. My second biggest fear was being a burden on my family in some way, having some, profound disability or strange behaviour or whatever. So it was great. And not having a memory. Imagine waking up and not remembering your child. Like, that would just be the most horrendous thing in the world. So they were kind of my biggest fears. But thank goodness none of them were realised. So I was in ICU. I was only in there until the next day. And they were giving me half-hour neuro-obs. Does anyone have an idea what neuro-obs consist of? Yeah. So they had those squeezy things on my leg. They were really cool. The automatic compression thingies. They were fantastic. They were kind of comforting. And it also means they don't give you the belly shot, because obviously they don't want any bleeding happening up here. So the calf compression was great, the half-hourly neuro-obs. I had a beautiful nurse. She was from Poland, and we talked all night about how did you go with your English when you arrived in Australia. She's like, oh my God, I couldn't figure out, anyway, it was hilarious. We had a great conversation. She was beautiful, and she was gorgeous. Back in the ward the next day, because of the incubation, my mouth was really sore. I think perhaps my jaw had been broken, or the temporal muscle may have been severed or stretched in some way when you're kind of on a wonky angle for 5.5 hours. So a lot of jaw pain, but no other pain, no head pain. So the soups were fantastic. I was at the Memorial Hospital. The food was great. I got into the soup because it was easy to eat and it was nutritious. And the old bowel movements. One of the things I talk about when I'm working with interpreters is like, for God's sake, medical staff come around, they go, have you moved your bowels today, Jodie? And for most cultures that's like, oh my God. So the nurses would come in, I'm like, I moved my bowels. I'm on fire. The physio came in and I said to her, look, I will be your best patient ever. I will do whatever you say. She was like, awesome. So I was doing all my exercises, and whenever I was just sitting around, I'd get up and go walking just to get myself moving, get my body moving again, get my bowels moving again after the anaesthetic. I played classic FM for the whole time I was in hospital, so that was good healing music. I was feeling lots of love coming from all over the place. And there's a couple of smells. I'll pass these around so you can have a whiff. I don't know, that olfactory memory, is it? The memory of smell is so powerful. Well, it was for me. So this is bush medicine, and I had a traditional healing treatment before I went away, and it took me back to those beautiful old ladies and what they did for me. These are Inindi beans. They have a wonderful smell. Every time I smelt these beans, I was just like, takes me home. Takes me home to sitting under a tree with those old ladies burning seeds and telling stories and laughing. So these were like my 2 transportation devices to bring me home. The next day with the MRI, nothing unexpected. So this is where the tumour was removed from, and that is just a normal level of bruising. So that was all good, happy with that. And yeah, just this jaw pain. So this jaw pain ended up referring into my ear. So once I left hospital a few days later, I was like, I think I've got an ear infection. I kept like harping on, I think I've got an ear infection, because it was just like having a middle ear infection, that pain, but it was referred pain from the jaw. And I did end up with a bit of a skin infection, which I had some antibiotics for, so nothing complicated in the scheme of things. Now, the thing that does happen, when you have your skull opened up, all your cerebral fluid comes out, of course. And I think it took about 9 days for it to build up again. So once I was released from the hospital, my partner would be driving along, I'll be like, dude, go easy on the potholes. You know, I could feel every single bump. I'm like, oh man, you know, easy on the brake, man. After about 9 days, this was no longer happening. So I think, you know, you guys know more about this than I do. It somehow, your body knows you've got to make more cerebral fluid, and it does so from the back here and fills that space back up again with that cushioning. So that was amazing. It's an amazing, amazing, amazing space. My scar is pretty tidy. He's an incredibly good sewer. It did get a bit manky in that I got like cradle cap. You know how babies get cradle cap? I had this cradle cap thing going on with my scar. So my sister's like, oh, just get a bit of, what's that stuff called? Like bleach, yeah, hydrogen peroxide. Like, yeah, a bit of hydrogen peroxide. So that was great. It really cleared it up. And it meant that I could keep an eye on to make sure it wasn't getting, you know, infected. So, we'll unpack this LGGDA IH1 thing. The anatomical pathology, this thing was taken to the lab and sliced up into 9 pieces to have a look at different aspects of it. So the diffuse means spread out, so it was wide. Originally, on the first image, doctor said, oh, it's 7 centimetres long, and he was worried about the length of it, because he said, look, by the time we get 7 centimetres from here to the back, we're starting to get into some pretty important spaces. So he did have some concerns about the length of the tumour. So diffuse just means spread out. Astrocytoma is derived from the astrocytes, the supportive structure of the brain, and astrocyte is star cell from the Greek translation. IDH1 is a genetic mutation that's being investigated around these kinds of tumours. So there's 2 genetic mutations that are being looked at. The IDH1 and the 1P19Q zygosity. So the first one was present and the second one was absent. And in the 5 research papers I read through ResearchGate of the most recent global research into this particular species of beast, yeah, they all said, and the specialist reinforced, that having the IDH1 was a good thing, that it slightly improved my overall survival rates, so that's a good thing. So how do you thank someone that saved your life? This is Dr. Santorinius, so I commissioned my friend to draw a picture of him as my superhero. When I came out of the operation, I opened up my eyes, I'm like, Duck, you're my new superhero. Keep your undies on the inside, eh? So I realised I still had my stupid sense of humour, but I was profoundly grateful. I do want to read you the letter I wrote to my 3 amazing doctors. So that's Dr. Super Santorinius. When I gave him this, I wrote on the back of it in Greek. Greek is his first language, and I wrote profound thanks. And he was like a little boy. It was so gorgeous. He was like a little boy at Christmas time with an amazing Christmas present. He ran out to show his wife, to show the lady in the office, like, look at this, look at this. So I felt really good about that. And this is my letter of thanks to my 3 Aussie Greek gods, Doctors Santorinius, Petulius, and Zoanati. A note to thank you. 3 weeks ago today, you held my life in your hands for 5 hours. Before meeting you, all of your reputations of highly professional and competent individuals and a cohesive team had preceded you and comforted me. Your bedside manners were relaxed and reassuring, your communication straight and accessible, your minds alert and your hands gentle and steady. I feel euphoric, alert, capable and determined to rebuild my fitness as I journey through whatever treatment is deemed most appropriate. Continue to be an effective partner and capable parent. Complete the last 2 assignments of my Master of Education and return to work as a trainer at the Aboriginal Interpreter Service, supporting the human rights of Aboriginal language speakers to hear, understand and be heard in the health, legal and social services sectors. I acknowledge that without your expertise and precision, none of this would be possible, and thank you from the core of my being. My son, partner, mother, siblings, family, friends, dog, rabbits and fish Also, thank you. Stay well, live long, and prosper, gentlemen. So I sent that letter off to my 3 Aussie Greek gods. So my recovery continues. I went back for my 6-weekly post-operative checkup, and in that report it says that I have a 6.4 by 4.9 by 3.2 defect. So that's the hole from which the thing came from. And I can actually sense this. So when I turn my head this way, the world turns into Picasso's cubism. When I turn my head this way, my vision is crystal clear. So I don't know, maybe that's that extra bit of brain falling into that hole. Anyone got any theories? I'd love to hear them. Dr. Santorinius wrote a letter to my GP, and I will just read that. So this is kind of the story. This is really tiny and I don't see very well. So, Miss Clarkson was reviewed in the clinic today 6 weeks following her right side temporal craniotomy and resection of her large primary brain cancer. She's recovered well from this. She's not had any significant headaches, nor has she had any seizures. She's not been driving, of course. She does feel her vision is a little fuzzy on the left side and tends to vary throughout the day. She says it's good when she closes her left eye. I suspect this problem represents a small field cut, but will be formally documented when she sees the ophthalmologist. Her wound has healed well. She has no other obvious neurological signs and has returned to high-level functioning and study without concerns. An MRI scan performed today shows an excellent resection of her right side temporal tumour. There is probably a small residual crossing the stump of the hypocanemus into the amygdala, I don't know, and the base, thank you, amygdala, and basal ganglia, as anticipated, but this represents probably a 99% resection of her tumour. The cavity is clean and filled with CFS. There is no evidence of enhancement. There is no mass effect nor any other concerning lesions. Her pathology, as you may be aware, has shown a diffuse low-grade glioma. The morphological features suggested oligodendral differentiation, but this did not bear out on the molecular studies, which showed no loss of heterozygosity for the 1p19q. And that will probably do. So anyway, I met with, so this letter went off to the radio-oncologist, the medical oncologist, and the neuro-ophthalmologist, and I met with all of them. Numbness gradually kind of subsided. It's still numb kind of here and on the actual piece of bone, as it still, takes a while to heal up, I guess. So I have lost vision. When I went to the ophthalmologist, I did a field view test and it shows that this vision here is gone. That may be permanent, that may be temporary. Every now and then I get these sharp pains in my temple, which I think of as a good thing because that's, things trying to find their way back together, nerve kind of connections. So when I went to the medical oncologist, he said, the first question was, are you having any seizures? I said, no, I haven't had any seizures since I started the Keppra, which I started sort of a week before the operation. And he said, right, if you were having seizures, that would be a reason for us to radiate at this time. But as you're not, we are not going to radiate at this time. That went along with all of those medical papers that I'd read, in that we'll keep this one up our sleeve for recurrence. The medical oncologist said a similar thing. It's like, no, we won't do chemo at this point. This is the kind of chemo we do that crosses the blood-brain barrier. You can have this oral medication and it means that, it's less kind of intrusive on your life than having to be hooked up to an IV. So she gave me all the information, but she's like, we're not going to do this now. This is for recurrence. So I finished my final 2 master's assignment, and next Sunday I get to wear a funny hat and a cloak and graduate. The feeling of joy was really profound. So when you haven't felt joy for 4 months, to get on your bike with your little boy behind, even if you have lost a bit of vision, I was confident we could do it together. It was all good. Riding along, singing and going down hills and going yee-haw. It was wonderful to have that sense of joy again. I've gone back to work. I work part-time, 5 hours a day, and I'm engaging in this community education kind of process so that as many people as possible can learn different aspects of this experience, and hopefully that will be useful in various spaces. So I want to thank all of you for being doctors and for caring and for dedicating so much of your life to the care of others. It's a wonderful thing that you do, and thank you very much. Mary, do we have any time for any questions?
Briefly.
Okay. Anyone have any questions? Yeah.
I imagine, being in your situation, I would have thought about someone very similar to me,
Yeah.
who was Indigenous and didn't speak English as a first language, going through the same journey. I imagine you thought of that too. What do you think about that?
I think there's so much work to do. If anyone's looking for a PhD, there's definitely a PhD in that whole space around how people would express this symptom if they were feeling this déjà vu, this aura. How would that be expressed firstly in first language, and how would the interpreter pass that message over to you as the professional? So there's an enormous amount of work there, which I'll just continue doing anecdotally through my work. But yeah, if there was anyone out there who wanted to do a PhD, it's a huge space that how many people are overlooked because their symptoms aren't able to be fully expressed. How many people end up in a mental health spiral rather than, a neurological spiral because of these linguistic differences. So yeah, I think it's a huge place where we need to learn.
So that was the diagnosis. What about the management? You've had many complex interactions since about any number of things, whether it's the physiotherapy or the radiation oncologist or possibly in the hundreds of interactions.
Yeah. My only message is always use an interpreter. That's why we have a service, so that people can fully express themselves and people can fully understand what's happening to them. Yeah. Any other, did that answer your question? Yes.
Yeah, another question. What did your partner think about all of this?
I was lucky that he was the kind of person that stays calm in a crisis, because the last thing you need when your life starts to spiral is someone else going and having that nervous energy around. So he's just a pretty even as she goes kind of personality in a crisis, and that was enormously helpful. There was times when he said to me, "This is surreal for me, and I just have no comprehension of how surreal it is for you." And those kinds of things were great. They were really validating, and it meant that he could express kind of how he was feeling in this incredibly strange space. And yeah, well, you're right. It's totally surreal. I'm seeing it from the inside. You're watching it from the outside. One of the hardest things in this whole experience was telling people, telling my loved ones, because every time you tell someone this news, you're burdening them and you're shocking them, and you vicariously get that trauma again and again and again. So that was one of the hardest things through this whole experience, was telling my loved ones about it and feeling their sense of helplessness. So putting them on task, particularly my mother. Yeah, really hard. But then being able to call her half an hour after surgery and say, "Hey Mum, I'm fine, I'll be seeing you soon," and to hear the relief in her voice was also amazing.
It is actually terrifying how little